Let me introduce myself. My name is Amanda, and tonight I am pleased to be welcoming back Rebecca McDonald with Shine. She is going to be presenting to us this evening our program, which is Welcome to Medicare. Happy 65th birthday. So we're going to learn all about the Medicare enrollment process and some tips and good information. But before we get right into the program, I do want to share this book recommendation with you. This is a book that comes out annually, and it is Social Security, Medicare, and Government Pensions. Get the most out of your retirement and medical benefits. So this is the 2021 edition. You can find this in the library catalog. It is a physical book that you can order, you can put on hold, you can find at the library. And if you want to find that in our catalog, you can find it at hcplc.org/books. Okay, but let's go ahead. That will have some good information, but so will this program.
All right, thank you so much, Amanda. Welcome to Medicare, Medicare Basics, which path is right for you. So Shine, I'm a volunteer with the Shine program. It is one of the many programs provided by the Department of Elder Affairs so that Floridians can get information to help you age with dignity and purpose and try to stay home as long as you can. Our particular mission is to provide free and unbiased health insurance counseling. We're all volunteers, we're all specially trained in Medicare, and we're all dedicated to giving out this information. So when the time comes, when you turn 65 or when you finally retire and don't have your employee health insurance, there's a lot of stuff you need to know so that you can make an informed decision. It's a lot of information. Some people have to come back twice or three times even. So don't be discouraged if it all sounds like too much by the end of the time that we're done. Everyone has that same feeling. So Shine, as I said, is a program that's offered by the Department of Elder Affairs. Everything we do is free, it's unbiased and confidential. We don't tell you what to choose for your health coverage. We just give you the information and the tools to make your own decision. So we're not an insurance company and we don't sell insurance. So all of the programs and resources are available throughout the state of Florida from different aging and disability resource centers. Ours is called Senior Connection Center, and we serve 5 counties: Hillsborough, Hardy, Highland, Polk, and Manatee County. So if you don't write anything else down tonight, try to write this number down: 1-800-96-ELDER, 1-800-963-5337. This is the number, like if you wake up in the morning and you say, I know she said something about what I'm interested in, but I don't remember what it was, or just want more clarification, call the Elder Helpline and they'll get you in touch with one of the volunteer counselors in Shine, and then we talk to you on the phone and help you understand some of the things that maybe you're a little bit confused on. As I said, it's a lot of information and sometimes you have to go over it a few times to make sense of it. So make sure you have that number. So Shine, what do we do for you? Well, we help you with anything that has to do with Medicare. Original Medicare, which is all there used to be. Medicare Advantage plans, now called Part C. Original Medicare is Part A and Part B. Medicare prescription drug coverage, which is called Part D. That one's easy to remember. Medigap or Medicare supplement insurance plans, which we'll go over that, how to choose one, what you can use it with. Extra help for prescription drugs. This is one of the 2 financial assistance programs that we can help screen people for. And if you meet the qualifications based on income and assets, we can refer you back to a person at the Shine agency, and they can help you apply for these assistance programs. Medicare fraud and abuse. Well, we have to really talk about that now because with all the COVID stuff, that's got everybody out there trying to get your Medicare number and get your money. So we talk about that. Medicare Savings Program is that other financial assistance program I mentioned. Extra help has to do with your Medicare premium, Part D, drug premium, and your drug copays. The Medicare Savings Program has to do with your Part A and Part B premiums based on income and assets. We'll go over a little bit of that as we go along. Long-term care planning. We do talk to people about long-term care planning, just trying to point out that it's something that you need to think about before the actual need. A lot of the programs and resources, there's waiting lists. So if you see that there's going to be a need for long-term care planning in the future, now is the time to talk to one of our long-term counselors and get started with some of the programs that you or your loved one might be eligible for. So when the time comes, you've got everything in place and you can just, move on seamlessly. Medicare complaints and appeals. Medicare does deny claims every once in a while. And so if you don't know why, or you think you have a legitimate claim or just need someone to explain it to you, again, call the Shine counselor at that 1-800 number, and we'll help you through the appeal process. And if there's a legitimate complaint, or we have good reason to appeal the denial, Medicare is fair about it and they will change their mind. So since this is Medicare Basics, we'll start out with what is Medicare. It's federal health insurance for individuals. There's no spousal coverage. There's no family plan. Every person has their own individual Medicare health insurance. It's administered by CMS, the Center for Medicare and Medicaid Service. This is the official logo. You'll find that on all the envelopes in the mail that you get from Medicare. So I know we get a lot of mail that says, important message from Medicare and open this now, it's something from Medicare. But unless it has that CMS logo on it, it's really just somebody else trying to get your money. So once you turn 64, your mailbox is going to fill up. And the only thing that you really have to pay attention to is anything from Social Security, anything from CMS, or anything from your current health plan. Everything else is just advertisement, and there'll be a lot of it. And you get started, you enroll in Medicare through Social Security. That's like a question that we get a lot. How do I start with Medicare? Well, it all starts with Social Security. So to be eligible for Medicare, you need to be a United States citizen and age 65. But just like everything else, there's always exceptions to every rule. You can be a legal permanent resident of the United States for 5 continuous years. That's continuous. You can't be here for 3.5 years and go back to your home country for 6 months and then come back and finish out the 5 years. It has to be 5 continuous years. After that, you are eligible, excuse me, you are eligible for Medicare. Individuals receiving Social Security disability income for 24 months. This is people that are on disability, and they have to be receiving that check from Social Security. It has to be a recognized disability. After 24 months, they are automatically transitioned into Medicare coverage. So that's why a lot of times in conversations or whatever, you'll see somebody say that they have Medicare and they obviously aren't 65, but it's usually because they've been on disability and have been transitioned to Medicare. Individuals with end-stage renal disease, which is like needing a kidney transplant or receiving dialysis. There's like obviously 4 stages to renal disease. So end stage is dialysis or needing a kidney transplant. So those individuals automatically become eligible for Medicare. And anyone with ALS, there's no age limit on the people with this particular disease, and they can get Medicare at any age. So how do you enroll? Well, if you're already getting Social Security benefits for whatever reason, maybe you started taking early retirement and started getting some Social Security benefits age 63 or something like that, for whatever reason, if you're getting some form of check as far as that is from Social Security every month, then when you turn 65, you'll be automatically enrolled. So if you're getting Social Security every month, you'll get a packet of information. It'll have your Medicare card and all the information you need, and you're automatically enrolled in Part A and Part B. If you are not getting any Social Security benefits and you want to have, Medicare Part B, like maybe you're working in a small group and you want to have Part B as your primary and keep your employer insurance as secondary, you have to voluntarily enroll during your excuse me, official Medicare enrollment period. Excuse me, hairball. Um, official Medicare enrollment period has to do with your birth month, and we'll go over that a little more in detail in the next slide. So the best enroll during your initial enrollment period. And if you miss that for some reason, then you have to wait until the general enrollment period, which is January 1st from March 30 to March 31st. And your coverage doesn't start until July 1st. So you can see there's a delay in coverage there. However, if you're working when you turn 65 and you get your you get your stuff from Social Security, and you don't need Part B because you already have other coverage from your employer and you're going to keep working. And then maybe 6 months down the road, you decide, oh, I think I do want to retire after all. You're entitled to what they call a special enrollment period. So you don't have to wait until the general enrollment period. You can go ahead and you have 60 days. 60 days to go ahead and get enrolled in Medicare. So you'll know if you decide you're going to retire, you have an end date for your employer insurance, and so you can just get enrolled in Medicare to start the next day. So there's no lapse in coverage. So the initial enrollment period, as we said, has to do with your 65th birth month. You can sign up for Medicare anytime in the 3 months prior to your birth month, and your coverage starts on the first day of that month, even if your birthday's on the 31st. So you can see it's to your advantage to go ahead and get signed up and get it all taken care of, and then comes the first day of your birth month. When you turn 65, you're covered. If you wait until your birth month, then your coverage doesn't start until first day of the following month. So if your birthday is April 2nd, you're going to be the rest of the month without coverage. If you wait until the month after, then there's a 2-month delay, and so forth and so on. So we pretty much all know when we're going to turn 65. So really good idea to go ahead and get enrolled and have it be effective date the first day of your birth month, which it will be automatically. And again, these are all questions that Shine counselors can answer. We'll go over all of this with you in detail if there's things you don't understand. So this is one of the things that you can download and print out, and this is kind of helpful. It just simplifies things quite a bit. So there's two ways you can get your Medicare coverage. It's like the left side and the right side. The one hand is original Medicare, which is all there used to be. And original Medicare consists of Part A, which is hospital insurance, and that has premiums and a deductible. And then Part B, and I say and or Part B because if you're still working and you have your employer health insurance, you don't have to get Part B as long as it's considered credible coverage. And with Part B, you have a monthly premium and there's deductibles. I used to say there's no reason not to get Part A. It's just additional hospital insurance, but we have more and more companies going to HSA coverage, the health savings account. So before you join up for Part A, check with your human resource people and make sure that you're not going to have any conflict with your current health insurance by signing up for Part A. There's a lot of times with the HSA, you can't get Medicare or it will negate your employee health insurance. So check with HR and say, is there any reason I can't join Part A when I turn 65? And if they say no, then just go ahead and get Part A. You'll get a card that says eligible for Part A only. And like I say, it's just additional hospital insurance. You may never use it, but you'll have it. Optional coverage with original Medicare consists of Medigap, which we'll discuss in a little more in detail, and we're going to go over Part A and Part B today, and Medigap a little more in detail as we go along. And then Part D, the prescription drug plan. And we'll discuss Part D and the Medicare Advantage plans, because on the other side of the page, you have Part C. So this is the other way to get it. It includes everything that you get with Part A and Part B. It's just like one-stop shopping. Your Medicare Advantage plans includes both hospital and medical insurance, and most of them include the prescription drug coverage, and you have premiums and different deductibles. But we're going to be here again on Monday night, the 10th at 6:30, and then we're going to go over Part C, Part D, and I'll think of the third one here. I just had a little blanco there. So anyways, I'm just Part A, we're going to go over this a little more in detail. Part A, as we said, is your hospital coverage. Part A covers anything that happens while you're in the hospital, and you have to have 3 midnights. You have to be in there for 3 midnights. So that's like, I call it the 3 midnight rule. So if you're in there for less than 3 midnights, then it's considered outpatient and be covered by Part B. So anything that has to do with the 3 midnight inpatient hospital stay is covered by Part A. Part A also covers blood, but not the first 3 units. So if you get 3 units of blood, you either have friends come in and replace it, or if you have a Medigap policy that covers those first 3 units, then you're okay. But Part A does not cover the first 3 units of blood. Part A also covers skilled nursing facility cares associated with that inpatient hospitalization, and home health care also associated with that inpatient hospitalization, and hospice care. So there's another handout here that shows you the different, this is kind of an awkward place for this handout, but just shows you the different combinations of what you can get, both the original Medicare, so if your hospital and your medical, and then a drug plan. You can have A and B and Medigap. You can have A and B and TRICARE. So there's just a lot of different combinations that you can have. So there's just more information here. So we'll get back to Part A. So under original Medicare Part A hospital coverage, the cost, you can go to any provider that accepts Medicare, and that means that that provider accepts assignment from Medicare. They have a contract with Medicare to accept what Medicare allows for that service. So if you go to see the doctor and his bill is $100 and that's what Medicare allows, and he has a contract with Medicare, he files that office visit of $100 to Medicare, and Medicare will pay a portion of that. That's under Part B. But so the when they accept Medicare assignment, then that means that they have to accept what Medicare allows. So you can go to any provider that accepts Medicare. If for some reason you find yourself going to a hospital or something, skilled nursing facility care, and they don't participate with Medicare, it is going to be more costly to you. So that's a good question to ask any provider, whether it's inpatient or whatever. Do you accept Medicare? So if they do, then you're good to go. So as we said before, Part A is premium free for most people if you have a work history with Social Security. I think it's like 40, I don't know, whatever but if you have any kind of a work history with Social Security, then you don't have to pay for Part A. For people maybe that are getting it, having been here for 5 continuous years and they don't have any work history, then they will have to pay that Part A premium. That's around $200 or something like that. But for most of it's premium free, and it's just like I say, if you have other health insurance, it's just extra hospital insurance. The benefit period deductible is $1,484. A benefit period starts the day you start receiving skilled nursing care. So like the day that you're admitted to the hospital and you're receiving skilled nursing care, that starts your benefit period, and it goes for 60 days from the time you no longer receive skilled nursing care, which is all very confusing. But you go to the hospital, whatever problem you've got, you're in the hospital for 5 days or whatever. You've started your benefit period deductible. You've paid your $1,484. You go from the hospital to the skilled nursing facility care for 2 weeks, and you're still in the same benefit period. And then you go home, and if you go home and you still have to receive some skilled nursing care, dressing change or IV or something like that, you're still in this benefit period. Then the first day that you're not receiving any skilled nursing care, that starts your 60 days. So if you go back to the hospital anytime during that 60 days, on the 45th day that you're home, you're still in the same benefit period. You don't have to pay another deductible. But if you're home and not getting any skilled nursing care, and then for whatever reason you have to go back to the hospital on the 65th or 70th day, you're going to start another benefit period, and you are going to have to pay another $1,484 unless you have a Medigap policy that takes care of your Part A. So it's possible to pay more than one deductible in a year for Part A. And again, these this timetable in the 60 days, it's all things that Shine counselors can explain to you a little more in detail and not quite so much information all at one time. If you're in the hospital for more than 60 days, there is an additional copay for inpatient coverage. They don't make you pay a whole nother $1,484, but there is a copay unless you have a Medigap policy that pays the hospital copay after 60 days. Different costs for other Part A services. For the most part, Part A does cover pretty much everything that happens to you in the hospital. And as we said, financial assistance is available with a Part A and Part B premiums through the Medicare Savings Program. So if you want to see if you're eligible for that, again, you call that 1-800 number and say, I want to see if I'm eligible for any help, financial consideration, and our Shine counselors can counsel you or screen you for that. So the second half of original Medicare is Part B, which is everything else. It's your medical coverage. Anything that has to do with doctors, doctor services, outpatient care, outpatient surgery, outpatient physical therapy, rehabilitation, anything that has to do with home health services is an outpatient. So you go to the emergency room with a broken ankle or whatever, and you're not an inpatient and you go home and the doctor says, okay, we want to have people come in and maybe do some physical therapy for you in your home health services because it's associated with that ER visit. That's all covered by Part B. So you can see that some services are Part A and some are Part B. Durable medical walkers, wheelchairs, canes, anything that has to do with insulin pumps and stuff like that is all considered durable medical equipment. And preventive services. I gave another talk today about preventive services. In your Medicare new handbook, which you'll get when you become eligible for Medicare, and they send a new one every year, there's a list of the preventive services. So flu shot, pneumonia shot, hepatitis B testing, cigarette smoking cessation. There's a lot of things that are covered under preventive services. So I encourage people to look that up either at medicare.gov, the website, or in the Medicare new handbook, just to see. And when you go to your doctor, say, oh, I got Medicare now, let's get some of these tests. So that's good to know too, that you got a lot of preventive services. So the costs for Part B, there's a certain number of people that will still be paying $110.40 some cents simply because their Social Security, the raise in their Social Security is not enough to bring them up to where they could pay $148.50. If they did, they would be receiving a smaller Social Security check. So those people where the increase is not enough to bring them up to $148.50 are sort of held harmless, so that they're not getting a smaller check. But the rest of the beneficiaries, most of us pay $148.50. If you have a higher income, maybe over 80 some thousand or something like that a year, I don't know about that, but I still pay $148.50. They do pay a little bit more, people that are in the higher income. So for 2021, our annual deductible is $203. So that means at the beginning of every year, you are going to have to pay somebody that amount of, like to say, if the office visit is $100 and Medicare allows 80% or $80, then your portion would be the $20 or 20%. So Medicare only pays 80% of most Part B claims. Unless you have a Medigap policy that takes care of your Part B copays, expect to pay some money out of your pocket. And then every provider does it different. They may say, we'll file that to Medicare, and they'll put the amount towards Medicare, and then you'll get a bill from the doctor or the provider, or they'll take the money then because most of them know what's allowed for an office visit or what they can charge. And so that's 20% co-insurance for most Part B services. And that's just like Medicare Advantage plans have a copay of $5 to $10, and under original Medicare, it's just 20%. And the difference there is you don't really know what they allow, so you don't know what your 20% is going to be. So Part B that's the other half of original Medicare. And with those two, you can have a Medigap policy, which is a supplement to Medicare. This does not have anything to do with Social Security. This is something that people choose to have, and it's private insurance companies You pay a check to that private insurance company every month. It doesn't come through the government or Social Security. It does have to be sold as a Medigap policy. It does have to be approved by Medicare. So if you buy a Medigap policy, then you know Medicare says, yeah, this is a good one. So what Medigap policies do is they bridge the cost gaps we've just been talking about, the 20%, the deductibles and whatnot. So I think there's only 8 policies now, but there's used to be 10. Anyways, you can see why it's confusing to people because they decided to give these alphabetical things too. So you have Medicare Part A and you have Medicare Supplement Medigap Policy A. That's why it gets confusing. People do get confused about Medigap, but it's not really that confusing. They all have 4 basic benefits. So you can get one that just has the basic benefits, or you can get one with all the bells and whistles, which of course is going to cost you a little bit more money. But all of them have the Part A hospital copay. Remember, we said after 60 days. They all have hospice coverage. They all pay the Part B copay, that 20% we just talked about. And they all cover the first 3 pints of blood, which is not covered by Part A. So you could get, ones with the basic benefits, or you could go ahead and get one with more bells and whistles, more benefits. There's different ones, like they pay the deductibles. And again, if you go Google Medigap Policies, or you go to the Medicare.gov website, it'll bring up a list, a chart of what benefits are under each one. And you do have to shop around a little bit for Medigap Policies, because even though no matter who you buy it from, it's the same benefits, it's just the cost is different. So Company X can sell Plan A for 150, where Company Y may charge 200. So you're better off going with Company X because it's the exact same coverage. So a little bit more about Medigap is you can't use it with the Advantage plans. You only can use it with Part A and Part B. So if you have a Medicare Advantage plan, there's no need to get a Medigap policy. Medigap open enrollment, it starts with your enrollment in Part B, whether you're 65 or 75. So it doesn't matter. If you wait until 75 to start Part B, then your Medigap open enrollment starts when you start Part B, and it lasts for 6 months. And what that means is you have a guaranteed issue right. So for those first 6 months, no matter what's wrong with you, no matter how long your problem list is, you can be sold a Medigap policy. That's the best time to get the best price. They can't deny you or charge you more for pre-existing conditions. You can buy a Medigap policy anytime, but if you're past that open enrollment or your guaranteed issue right, then they can subject you to their medical underwriting, and it will cost you more money. So I think we're going to stop here. I don't only have like 1 minute for questions, but if you come back Monday night at 6:30, then we'll cover Part D and the rest of the Medicare Advantage plans.
Well, thank you, Rebecca. And we can go a little bit if we get a
Okay,
couple
good.
questions in. We won't cut right off. But I do want to remind anybody that maybe joined us a little bit after the start. There is the opportunity, if you do have questions, to put them in the questions section, and we can answer those right now. We also want to let you know, as Rebecca mentioned, I did put the link. We will be back again next Monday night. So we've done Part A and Part B today, and you covered the gap, I can't remember
Medigap.
exactly. Yeah, Medigap, exactly, Medigap. And then on Monday, you're going to be doing Part C, Part D, and SMP. So that will be the
That was the
program, will
third one.
be the additional information. You can go ahead and just click on that link, or you can go to our calendar of events and find it there. So we do have one question in already, and that is, you mentioned at the beginning fraud, Medicare fraud, and we know unfortunately that is very topical right now with everything that's going on with COVID and a lot of those messages coming out. There's a lot of disinformation kind of floating around out there. What are some recourses for people who have had Medicare fraud? Is there any through any agencies they can go through to recoup any of those losses, or where should they go if they have encountered that?
Well, Amanda mentioned SMP, which stands for Senior Medicare Patrol, and those are specially trained volunteers within our group of specially trained volunteers, and we have a really good group. So you would call Shine and say, I think I've been a victim of fraud, and then they're going to refer, one of our SMP volunteers is going to contact you and get all the details. In fact, one of them was on TV about the braces situation. People were getting braces. So yes, you call Shine for that, because we have some really good people that's all they do is get you, find out what happened, track it down, keep it from happening to other people.
And then, Rebecca, can you go back to the slide or share with us again just the contact information? Because I know we did have a couple people who were so happy joined us, but maybe a little after the start of the program, just so they can see the contact information.
I don't know if I can go back all the way or not. I don't think I can go back, but the number to call, I'll
We'll
give you
give
the
you
phone
that.
number. Yeah, it'll take too long to go back through it's 1-800-963-5337, 1-800-96-ELDER.
Okay, so we
And
do, yeah.
yeah, and if you have a Medicare and You handbook, the Medicare and You handbook, it's on the back of that. It's on the it's in a lot of places. And Amanda has all of these downloads. That Shine Rack card has a lot of information on it about what the Elder Helpline will help you with, different things, transportation, housing, air conditioning, and more about what Shine can do, and the numbers are on that. So that would be a good one to download.
That would actually, so that's a good point. So I'm going to go ahead and start to bring up our closing slide. But as we do that, if people want to check out, we do have 4 handouts that you can download in the handout section. It's all great information. The contact information will be there. So I'm going to go ahead and do that. And then I'm going to bring up our closing slide to give you the library information. So let me do that quickly.
Yeah, I can't do anything quickly to get back to that.
Well,
Thank you
relatively
all for
quickly.
listening.
Okay, so let's go ahead. And as we are closing up here tonight, I just do want to remind people, if you want to find more programs like this, definitely go to hcplc.org/events. That's where you're going to find our full events calendar, including, yes, another plug for that Monday night program. You can find that there, as well as other great things that are coming up. We are just on the cusp of summer reading. That's going to kick off on June 1st. And a reminder, that is for all ages. We have all sorts of great events, activities, prizes that you can do for summer reading at any age. So check that out at hcplc.org events. If you do have any questions about the library, getting your library card, using your library card, you can always give us a call at 813-273-3652, or you can connect with us online at hcplc.org/contact. That looks like we're going to wrap it up for tonight. So just a reminder to everybody, thank you once again for joining us. If you do want to review any of the information in this program, we are going to be posting it to our YouTube channel at Tampa Hills Lib. So thank you so much, Rebecca, for being here to present tonight. We will look forward to seeing you next week. Thank you to everyone who attended tonight, and have a good evening.
Good night.